but the reply he gave me was not the information I wanted. So I sent him another message again for the past, that's since on, is it Friday? And up till now, he has not replied again. So I was thinking maybe he has resolved the problem. So inshallah, I'll still contact him again.
I'm trying again.
But I noticed that some of you were able to submit your attendance on iTalim. There are a few students that I've seen.
Yeah, but already show up.
Already show up now.
Yeah.
All right, so please try to submit your attendance on iTalim. I think the problem has been resolved. Or sometimes it's that it's not okay. All right, I think I will take note of this because I've actually been trying to push the person in charge. I initially sent him a message, there was no response, then I followed up and he later responded, but the message he sent to me was not the information I actually requested for. So I emailed him back to tell him that, okay, what you have responded, the answer you have given me is not what I demanded for. But since then, he has not responded again. I thought probably he's on leave and cannot respond to his email. So I just want to give him time and see if I don't hear from him today, inshallah, tomorrow I will send him another email to remind him about the requests. Meanwhile, please just bear with me, and then if we can't take attendance via iTalim, then we're going to use I think the PIC have been generating a QR code for you to submit your attendance. So I think we can also use that as a backup. So later on, I'm going to key in the attendance into iTalim by myself, and then the percentages, I will let you know of the percentage if any of you is below the percentage that is recommended by the academic units. Wow, submission still button still not appear. Can you just wait, hang on for a few seconds and see if it will pop up? Because the sister just said now she tried and she couldn't, there was no submission button. A few seconds later, she said she found this submission button. No submission button. Okay, then the PIC, can we just use the attendance you have been using, you've been generating? So after the lectures, you just send me the attendance. Okay, Nabil, I think your comment is noted. I'll still get back to ITD to let them know this is the difficulty my students are having for my course. All right, you're most welcome. So I think today we're going to talk about something small, but sometimes very confusing. Okay. Oh no, I can start from here. Can you see my slide?
Yes, doctor.
Okay, so today we're going to talk about how to define variables and how to determine your variables when you want to conduct research. So first, before we talk about how to define and how to know the kind of variables you have to include in your research, let's define what is a variable. A variable basically is any characteristic that you measure during the course of your research. It could be the demographic characteristic of your patient, of your respondents or patients, depending on the situation, on the people you are investigating. For example, you have the age of your respondents, the gender, the family income, the diagnosis of a patient if you are dealing with patient in the hospital, the number of medications they receive, if they have comorbidities or other things, or the kind of treatment they receive. All of these things that you measure in the course of doing research is called a variable. So there are different types of variables, but the most important thing you need to know is that whatever you are measuring, be it knowledge of your respondents, be it their attitude, be it their perception, be it their practice, or anything that you are measuring among the people that you are investigating is called a variable. It may be your research objective, and probably it may not directly be your research objective. Probably it can be the demographic characteristics, and it can be your research objective also. So in other words, you can also describe a variable as the basic element that is measured in a research. Basically, the two definitions are talking about the same thing, the characteristics of interest and the basic elements. But the most important thing is that you measure them during the course of doing research. And it is called a variable because it is dynamic. It changes with time, and it varies between one person to the other. For example, now, if you want to measure knowledge of something, or say maybe COVID-19 among year 3 students, including pharmacy, all of you are not going to have the same level of knowledge. There are going to be differences in what? The knowledge level of the students. Secondly, within an individual, a variable changes with time. For example, another example I'll give now is suppose during the COVID-19 MCO, Movement Control Order, you decided to investigate the level or the prevalence of depression among people in Kuantan. The level of depression at that time may be higher compared to if you want to conduct the same study right now, because there is no CMCO right now in Kuantan, although there are in other places. But in Kuantan now, people are moving about freely, although with some restriction. So the level of depression is going to be different compared to when people were under lockdown. So this shows you that there are people who could have been depressed at that time, but are no longer depressed at this time. So this is what makes what you measure in research a variable. It's not something that is fixed. It can change. It varies between one person to the other, and within one subject, it can change from time to time. So how do you locate a variable in a research? This is my own research, so I can use it without any restriction. So that's why I'm using it. So in a research, you can look for the variables by looking at the abstracts. If you want to see the details of the variable, you go to the results section, and if you want to see the definition of the variables, usually you look at the method. How does the investigator define the variables they have measured? So in this study, what I tried to do was to see what is the prevalence of antibiotic use among patients who are on admission in the hospital. What are the types of antibiotics that are used, and what are the reasons or the indications for using these antibiotics? So by definition, my variables in this study include the prevalence, how many patients are on antibiotic. The second is the indication for antibiotic use. Why? What are the reasons for antibiotic use? The third one is the type of antibiotic that the patient have been given. But beside this, there are other variables that I also collected. I collected the ward or specialty that the patient was admitted in, the age of the patient, the gender of the patient. All of these are variables in a research project because you have to measure them. If you give a questionnaire to people right now, before you give the questionnaire, you have a demographic section. That demographic section will measure their age, their gender, their race, family income, area of residence, and some other things that you find, some other information that you feel is relevant to your research. And then later on in the questionnaire, you now measure what is it that you really want to measure. Is it their knowledge of certain things? Is it their perception of certain things? Is it their attitude towards a certain event or things? Is it their adherence to medication? Is it the treatment outcome that they have after receiving treatment with some medications? So all of these are variables in your research project. I think I will talk about some of them just briefly shortly. So in this study, we look at hospital or community-acquired infections and surgical prophylaxis were one of the very major, most common reasons why patients were given antibiotics. So under the indication for antibiotic use comes these factors. Under the prevalence, you have the number, what was it? And then under the types, you have the different kind of antibiotics that were given to the patients. So in this second study, here, what we tried to investigate was to see the knowledge and self-confidence of antibiotic resistance therapy as well as antibiotic stewardship among final year pharmacy students in 3 countries. So here, from this abstract, you can easily fish out what the variables are likely to be in your study. The first one is here. We try to look at the variables for this study. I will do what include the knowledge, because that is what we want to measure. Knowledge of what? Knowledge of antibiotic resistance is one variable. Knowledge of antibiotic therapy is another variable. Knowledge of antibiotic stewardship is another variable. Their self-confidence, again, is another variable. So all of these that we measure are variables in our research. And in addition to these ones that I've highlighted, definitely we have to ask about the patient's age, the patient's gender, the patient's countries and other things, because we have to categorize them based on their country, whether they're from Malaysia, Indonesia, or Pakistan. Is this clear?
Yes, Doctor.
Or am I speaking too fast?
Clear it.
Okay, please, you can stop me if you have any question at any point. Stop me. I don't have any issues. Okay, you can ask questions. I'll stop and re-explain again. So for the third study, here we looked at what activities do pharmacists do to improve the use of antibiotics among patients in Nigerian tertiary hospitals. And then the other thing we look at is the barriers. What are the things that stop pharmacists from participating in things that will improve the use of antibiotics? So from here, you can easily fish out. One of the variables that will definitely be in my research is activities of pharmacists. What is it that they do? Do they review patient prescription? Do they monitor antibiotic consumption? Do they review patient prescription after 3 days to make sure that they de-escalate? Do they do TDM? Do they do, beside TDM, do they match the antibiotic given to the culture and sensitivity result? All of these activities fall under one variable called what? Activities. So what are the things that stop them from participating in antimicrobial stewardship programs are what? The barriers. The barriers can be lack of support from hospital administrators, lack of knowledge of antibiotic stewardship and antimicrobial therapy among pharmacists, and all other things. So these will fall under the variable called what? Barriers to pharmacists' participation. But beside this, there are other things that we also have to ask them, which include their hospital, the number of the bed size of the hospital, the number of pharmacists they have. So each of these is also a variable. Number of pharmacists, because definitely we have to measure it from them while doing the research. It's part of the questionnaire that we send. What is part of what we want to measure, even though what we want to measure is the activities and the barriers. We also need to know, are there other factors that influence these activities and barriers? Could it be because they have few pharmacists, they cannot participate, and then the workload is higher on them? Or could it be that the pharmacists have little knowledge, or most of them have few years of experience, and so there are no experienced pharmacists that can lead the such program? So whatever you measure in your research, be it the main theme of your research or not, is actually a variable. Okay, I try to do this with your own research project. I think we have members of Group 5 here. Group 5 members. Members of Group 5.
Yes, Doctor.
Okay, so is this the title of your project?
Yes, Doctor.
Okay, so I'm not, don't worry, I'm not trying to put you under the hot seat, okay? Looking at this from the title, you can easily pick out some of the variables that will be in this project. Can anyone try?
Knowledge.
Okay, very good. Knowledge.
Attitude.
Right, attitude.
Practices.
Practices, very good. Any other one?
Medical and health science students, is it?
Very, very excellent. So you need to know what category does the student belong to, whether they are medical or health science students. or you may decide to put it as their kuliya. So what kuliya do they belong to? Okay, so this is what we get from the title. I'm not saying that this is all the variables that will be involved in the research. Under the other variables that you will have to take include the age of the patient, the gender of the patient, the race of the patient, probably they may decide to take the family income as well as the area of residence or the source of information about COVID-19. Do they get their information from social media? Do they get their information from healthcare authorities? Do they get their information from people, from people telling them or friends? Or do they get them from newspapers or other mass media sources? So these are what will shape the variable. These are what we call the variables in a project. I hope this is clear.
Okay, Doctor.
Okay, do you have any question? I see I have other examples, but if you have any question at this point, I will entertain them before I move to the next example.
I think so far, no, Doctor. You may proceed to the next.
Okay, all right, thank you. So this is for group 12. Group 12 members, are you here?
Yes, Doctor.
Okay, so looking at this is your title, am I right?
Yes.
Okay, so can you tell me what are the likely variables that are involved in your project?
The variables are academic, emotional, and financial. And then the category we do the research on the IIU MK students.
Okay. So now the first variable is their perception towards academics, right? During the ERTL. Is that so?
Yes.
Okay, second variable will be their perception of the financial burden of ERTL. Am I correct?
Yes, Doctor.
All right, the third one you said is the emotional aspect, right?
Yes.
And then you made mention of the category of the students. Since we are dealing with students, are you looking at students within the campus, the Kuantan campus? That's looking at students in all the colleges in Kuantan.
IIMK Kuantan campus.
Okay, so that means one of your variables is going to be the kuliah of the students, right?
Yes.
Is that so? Okay, so based on the information she has provided, the sister has provided, one of the variables is going to be the kuliah of the student. What kuliah do they belong to? You can also look at the level of their study. Are they year 1 student? Are they year 2 student? Are they year 3? So all of these things that you put in your questionnaire are called variables. Although there are different types of variables, which we'll discuss shortly. Okay, group 13, are you here? Group 13. Can anyone speak up on behalf of the group members? Can you hear me? Hello? Hello?
Yes, Doctor.
Okay. Is this your title, group 13 members? Do you have members from group 13 in the lecture? All right, I think I'll proceed. So for group 13, one of the variables is going to be what? Religion. It depends on how you define the religion. This is where the definition will come in your methodology, okay? Besides religion, you have spirituality. After spirituality, you have medication counseling. So this will all be defined in what? In your methodology. And under your result, you're going to see how these variables have been categorized by the what? Researchers. So for group 14, Group 14 members, are you here?
Yes, Doctor.
Okay, can you tell me what are the likely variables involved in your research based on the title we have here? You may be in the process of designing your questionnaire, but you can just give us a glimpse of what it is.
Actually, the topic has been changed a little bit.
Okay.
The
The latest one, knowledge, attitude, and perception on medication adherence among IUM pharmacy students.
Oh, all right, fine. That is fine. All right, so if you're still assessing knowledge, attitude, and perception of medication adherence, so what do you think are the likely variables?
The knowledge,
Okay,
and then
knowledge.
the attitude,
Okay, attitude.
and then the perception on the medication adherence.
Okay, perception. Then is medication adherence a variable of its own?
Um, I don't think so.
Why don't you think so? You can either be adherent or not. You're either adherent to medication or you are non-adherent. So do you think that's a variable?
Oh, I think it's a variable.
So it's actually a variable of its own if you're assessing adherence, because you have to have a tool to access adherence. Okay? Then how about the category? Is there another category that can fall in here? Suppose you are doing it among pharmacy students.
I think it's the year of study can be a variable too.
Yes, year of study is a variable. So how about other demographic characteristics that you measure? In your questionnaire, do you have anything like age, gender, race, and other things? How do you intend to collect it? Maybe I think you are still building your questionnaire. By the time you build your questionnaire, you may realize you have this information there. Because usually if you are conducting research, you have to have this information. You need the demographic information of all your respondents. In most research that has to do with questionnaire, you have to get the demographic information of your respondent. So for now, that's why I'm taking it lightly. I don't want to stress you too much because I know probably some of you are in the stage of starting to build your research questionnaire. Okay, so variables, like I said earlier, they are the things that you include or you measure in your research. They can be your demographic information that you collect from your patients. They can be the major things or the objective of your research. If you are assessing knowledge, it can be attitude, it can be perception, it can be drug therapy problems among patients, certain group of patients, the types of drug therapy problems, when they occur. All of these things, if you are measuring them, are called variables in your research. The type of medications that are administered to the patient is also a type of variable. The treatment outcomes, whether the patient was cured or whether the patient had complications or whether the patient died, are all variables that you can measure in your research. So now let's look at the types of variables. Research variables can be classified in two ways. You can classify variables based on how you measure them and based on the relationship between them. So here we're going to talk about classification of variables based on how you measure them. Based on how you measure them, you have what you call the discrete variables. Discrete variables are usually variables that you can count. They're variables that you group into, you divide into a group, and then the respondent can pick from. Suppose, like, for example, you want to ask if a patient has taken breakfast or not. It can be yes, it can be no. You can ask your patient if he's adherent to medication or not. This can be grouped into two groups or more, depending on how you measure them. And sometimes it can be categorical in nature. For example, if I ask you now, do you agree that online learning is interesting? So how do you respond to that? Definitely we can use, because if we leave it as an open-ended question, people are going to see a lot of things that will make it difficult for you to come up with a conclusion. So you can easily categorize the responses for your respondents. You can ask them if they strongly agree, if they are neutral, if they disagree, or they strongly disagree. So if you look at it here, is that one thing with the discrete variable is that you cannot quantify the difference between the variables. For example, yes and no. You cannot quantify the difference between yes and no, except if you look at the number of people that pick yes and the number of people that pick no. But looking at the word yes, no, you cannot show if someone say yes, this is what it means, and no, this is the quantity that it means. You cannot quantify that. Similarly, in strongly agree, the difference between strongly agree and agree is just imaginary. You cannot quantify it. The difference between neutral and disagree is also imaginary, it's not quantifiable. But on the other hand, continuous variable is something that you can quantify. Continuous in such a way that it can continue up to what? Infinity. It is continuous. That's why we say it is continuous. Continuous can be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It is going on continuously up till what? Infinity. For example, and the examples I've provided here is if you want to measure the blood pressure of a patient, usually you use a signal manometer, right? And the blood pressure is going to be measured using numbers. And the numbers, for the numbers, there is a consistent difference between the units. If you say your patient have a blood pressure of 160, that's the systolic level, and another patient has 165, you know the difference between them is what? 5 units. You can easily quantify this into what? Numbers. For blood glucose as well, you can also measure this using continuous variables because it's in numbers. The weight of your patient can be 60 kg, 61 kg, or 62 kg. If you look at it, it is continuous in a way, and there is a consistent difference between the units. From 60 to 61, you know, is 1 unit. You can easily quantify that. It's unlike saying yes or no, which we cannot quantify, or saying strongly agree or agree that we cannot quantify. Okay, so I've provided examples for you here, and one of the examples I have here, suppose you want to pick the age of your respondents. In a research project, you can divide the age into different groups so that the respondent can pick if they are between 18 to 25 years, if they are between 26 to 40 years. Okay, so this way you are using the discrete variable approach because you have already grouped the variables for your respondent and they pick from this. Usually in this kind of variables, you can only describe them using frequency and percentages. You have, say, maybe 80% of your students or 80% of your respondents are between the age of 18 and 25. This is how you can describe your discrete variables. But on the other hand, continuous variables, since they are continuous, if you want to ask similar question, you ask the respondent of their age and you leave it as an open question. So each respondent is going to fill in his own age. So because here, the response we are giving in continuous we are giving us numbers and they are continuous. You can express these using mean, standard deviation, or median and and range. So that's one of the ways to differentiate. That's one of the ways to differentiate between the two. Another example I've provided here is, suppose you want to measure smoking status among your respondents. If you are doing any research among smokers, if you want to know their smoking status, you can use smoking status. Ask them whether to tick if they are smokers or they are non-smokers. This way, you've already grouped your response. Expected response for the respondent to pick from. Similarly, you can also ask the same question, a continuous variable. Ask them what is the number of cigarettes they smoke per day. Basically, if anyone picks 0, you know that person is a non-smoker. Anyone that picks 1 and above is a smoker. So you can then later on categorize the smokers into chain smokers, light smokers, and other definitions that you have to describe in your methodology. Because mind you, whatever definition you want to use to describe your variables should be included in your methodology. So your methodology should have to capture these, and then the result will only show what is the frequency, the percentage, or the mean and the median of what you have measured. Variables, like I said earlier, can be classified based on how you measure them and based on the relationship between them. Based on the relationship between them, we have 2 types of variables. We have dependent variables and independent variables. So dependent variables are actually, like the name goes, dependent. They depend on your independent variables. And dependent variables are actually what you want to measure, what outcome you want to measure, what are the effects that is being measured. For example, now if you are measuring knowledge, attitude, and perception, your dependent variables are going to be the knowledge, the attitude, and the perception. These are all dependent variables. And then what are the things that influences the knowledge? What are the things that influence the attitude? What are the things that influence the perception of your respondent? Are the things that make up your independent variables. They are the explanatory or the predictors of what your dependent variables, or the cause, the things that leads to what the dependent variable. Is this clear?
Doctor,
Yes.
can you please repeat again the dependent variable? I cannot get.
Okay, the dependent variable is the measure, is what you want to measure, as in the objective of your research. If the objective of your research is to measure knowledge, attitude, or perception, then your dependent variables are your knowledge, because knowledge is one dependent variable, attitude is another dependent variable, perception is another dependent variable, because these are the objective of your research. These are what you want to measure. These are the outcome you want to measure. Okay, and the things that can influence this can be what? The age of the respondent, the gender of the respondent, the race of the respondent, and other things. Another example, let me flip it. Let me give you another example. Suppose you want to measure, I think I have the example here. I have another example. Don't worry, I'll show you another example. Another example is, suppose you have a drug, okay? And then you treat patient with diabetes with, say, maybe metformin and glibenclamide. And you want to compare the difference between metformin and glibenclamide to see how well they improve glycemic control. So if you look at it, the end point of your research is to see what the effect of those drugs on what your glycemic control. So the outcome that you want to see is the what? Glycemic control, which is the effects, because this is the effect that depends on which of the medications you have given to your patient. Did your patient receive metformin? Did your patient receive glibenclamide? These medications that are given to the patient are your independent variables, because they are the things that will lead to what? The outcome that you want to measure, which is what? The glycemic control among your patients. Is this clear, sister?
Clear. Thank you, doctor.
If you're not clear, you tell me. I will explain in another way. Okay? I'm not the kind of person that get pissed off if you ask questions. If it's not clear, tell me to explain, and I will gladly do so. Is that clear with you?
So far, it is clear. Thank you, doctor.
All right, thank you. The independent variable, like I said, is manipulated. You can manipulate the medication that you want to give your patient. It's the treatment or the program or the cause of what you want to measure. And it's actually explanatory. It's explanatory variables. It explains what happens in the outcome. So the dependent variable is what is affected by the independent variable. Like I said earlier, your knowledge can be influenced by what? Your source of information, your level of study can influence your knowledge, your gender can influence your knowledge, your age can also influence your knowledge, as well as maybe background sometimes, okay? The effect or the outcome that you want to measure, knowledge. Okay, knowledge is, we mentioned knowledge as what? A dependent variable several times. Attitude, perception, or the treatment outcome of COVID-19, the patient died or the patient survived. All of these, if the patient died or survived, it depends on what kind of treatment the patient has been given. So the treatment the patient has been given is your independent variable, while the outcome of what is your dependent variable. In other words, it shows you that the patient died or the patient survived depends on what kind of the quality of treatment that was administered to the patient. Okay, and again, it's actually the response variable. So one example I have here for you is this. Suppose your class developed this new drug called RX16, and you want to test if the drug can prevent occurrence of stroke among patients with hypertension. So the first thing you do is you need to recruit your hypertensive patients. Okay, after screening them, they have similar characteristics. Then what happens is that you group them into two groups. You have the RX16 group, which is the intervention group, and then you have the placebo group, right? The placebo can be patient receiving other antihypertensive agents. So you can follow up your patient for up to 2-3 years to see what is the reduction in blood pressure among your patients, and what percentage of patients develop among the two groups. So this way you can be able to compare. If you have higher stroke in the placebo group, then you can say that RX16 is more effective than the placebo or the existing treatment. If you have higher stroke in the RX16 group, then definitely you know that your drug is inferior to what has been that what is currently being used. So, but looking at this, how then do you define your variables? Can you fish out the variables for me? Does anyone have an idea of what the variable is, what the variables are in this example? Or am I talking to myself?
And maybe the type of drug.
Yes, the type of drug, okay.
And then
Another variable?
And the target is hypertensive patients.
Okay. Okay, yes, hypertensive patient is a variable, okay, all right.
And
you can categorize them.
Is it the effect of the drug?
Okay, what's the effect?
Yes, the prevention of stroke.
Okay, the prevention of stroke and the reduction in blood pressure, right? These are all variables in the research. But which of these variable is the dependent variable and which one is the independent? Any idea?
Rx16 is the independent variable.
Okay. Rx16 and placebo are the independent variable. Then what is the dependent variable?
Dependent variable.
Yes.
Reduction BP or stroke happen or not.
Okay. Right. Excellent. So do you all understand this? Rx16 is your dependent variable, while the reduction in blood glucose and other things are the dependent. The reason is that if the reduction of blood glucose and the occurrence of stroke in your patient depends on which drug the patient is receiving, which one is better at preventing stroke and which one is better at reducing the blood pressure. So this is why he said this one that you are measuring, the final outcome, depends on this, which drug the patient receive, and other factors that can affect the occurrence of stroke among your patients. Okay, is this clear?
Yeah.
All right, so another example I have here is, this was actually a study that was conducted to.
Why placebo is independent variable? Can you explain more?
Placebo is independent. Placebo does not mean the patient receives nothing. It means that the patient may receive other antihypertensive agents, but the name is not mentioned because sometimes you don't want to, you may not want to show, you may not want to list out the medication that the patient has been given. So you can just label them as placebo just to cover up what they are doing. Then later on, in the time of publication, you can see what the medication is. So placebo is an independent variable because the placebo that your patient takes is what will determine the outcome that comes out of the treatment. Just like the Rx16. Rx16 is a drug given to your patient, and the effectiveness of this drug will tell us what will happen in your patient, whether the patient's blood glucose level will go down or whether the stroke will happen in the patient or not. So in other words, the occurrence of stroke and the reduction of BP depends on the medication the patient is given, whether Rx16 or the placebo. Okay, so Rx16 and the placebo are in the same category. They are all independent variables because they are the things that will tell us what will happen in our patient, whether the patient will have stroke or the patient will have a good BP control. Okay, sister?
Oh, that's how. Clear? Okay, thank you. Clear.
Okay, all right. So in this second study, the investigators tried to measure medication adherence among patients with type 2 diabetes. And judging by this, if you look at it, the objective was to assess adherence to medication and identify factors that are associated with non-adherence. So what do you think is the dependent variable here? And what is the independent variable? Are you with me?
What is the question again, Doctor?
So the question is that the objective of the research was to measure adherence to medication and to identify factors that are associated with non-adherence. So I've already listed out two variables for you. So which of these variables is the dependent and which one is the independent?
I think identify factors that are associated with the non-adherence is the dependent variable. Is the independent variable, and
Okay.
adherence to medication is dependent variable.
Okay, excellent. So this is showing that the factors that cause non-adherence are the things that will explain why your patient is adherent or not. In other words, it means that if your patient has those factors that lead to a non-adherence, your patient will be non-adherent, showing that the factors that affect non-adherence or the adherence of the medication to the adherence of your patient to medication actually depends on those factors that cause non-adherence. So looking at the results section, if you look at it, they found that about 53% of the population were non-adherent towards the anti-diabetic medication. So this is your dependent variable, because this is the main thing we are looking at. So for the independent variable, what are the factors that lead to non-adherence? Look at this here. We have one of them is age. The age of the respondent influence, particularly as patient of advanced age, tend to be more non-adherent to medication. Beside that, knowledge of the medication, the patient knowing when to take the medication, and lastly, the comorbidity that are involved. Patients with comorbidity are taking multiple medication, and so they are more likely to be non-adherent to medication. So this is how you identify your dependent and independent variable. Dependent variable is what happens at the end of the what. What happens? The independent variable is what explains what happens. Your patient is adherent to medication, fine. Or your patient is not adherent to the medication. Why? Because a patient is of advanced age, perhaps they forget. Patient has poor knowledge of their medication. They don't know when to take the medication. Patient have multiple comorbidities, so they are taking more drugs. So that is why they are non-adherent. So if you look at it, the adherence actually depends on these things that happen: the age of the patient, the medication knowledge, as well as the comorbidities. All right. So this is what I am going to stop here now, because we have been told to try to limit our lectures to 40 minutes to reduce exposure to your exposure to internet addiction or exposure to the to your screen. So what I want you to do is for all the groups, okay, we are going to converge here by I think 3:30. I will use 30 minutes for the last part, inshallah. So for all the group, what I want you to do is this. Oh, sorry, I will converge by 3:20. 3:20. So we'll use 40 minutes for the last lecture, and then I will take part of that to do this. I want each group to list out what are the dependent variables in your research and what are the independent variables. Just few of them. I'm not asking you to list out all of them. So please use the remaining time of this lecture to discuss among yourselves. I have group 1, group 2, group 3, group 4, group 5, group 6, group 7, group 8, group 9, 10, 12, 11, 12, up till 14. Okay? So this is what I want you to do for me now. So finally, to round up, one thing I didn't put in my slide is that for all of your variables, you may need to define what is the variable, because sometimes you measure them, suppose maybe knowledge, and you want to categorize the knowledge of the respondent into good, moderate, and poor. What is the cutoff and what is your reference? This should always be included in your what? In your research methodology. And I believe your supervisors will guide you through this. I'm just mentioning it so that you can know. But I'm pretty sure all your supervisors will guide you towards this. If there are other things that you want to use in your variables that you want to use in your research, you can easily define them in your method to avoid unnecessary questions coming up later on. Okay? So I think with this, I've overspent my time. I've taken 5 minutes extra of your time. So apologies for this. Do you have any question?
I think so far, no, doctor. We clear about the explanation.
Okay, so please, I want you to use the remaining time. By 3:20, I will start the second part. So when I come back, please, I will just want to take a few minutes. Each group, be ready. The moment I mention your name, just tell me what are the dependent variables and what are the independent variables. It's not just it's not something that you have to be 100% correct. I just want you to try to use what I've explained now to fish out the dependent variables and the independent variables in your research. If you do them, if you are correct, then fine. If there's anything I correct now, then you learn and you know how to differentiate between the two. Because I know sometimes it's difficult to comprehend. I actually know this. It's difficult for people to understand the difference between dependent and independent, because even personally, sometimes we to ourselves, we have to watch carefully to know, to sit back and think before we can differentiate between dependent and independent. And sometimes they interchange. A dependent variable can become an independent variable within the same research. So, but for your level now, it's important you just know how to differentiate between the two. Know which one is the outcome and which one is a predictor, which one leads to or explain the outcome you want to measure. So try to do this with your own research topics. Just list out like 3, 4, 5, 6 of your variables. Know which one is dependent, which one is independent, and that's all.
Doctor,
Yes.
I have a question. Is it possible for the independent variable to be only one?
So it's possible sometimes, but in most cases, it's more than one.
All right, doctor.
It's more than one. So you can have one, you can have more than one. It's still the same. But your dependent variable can be one. It can be more than one in a research. I think we mentioned several dependent variables during the course of the lecture. So, but when I come back, when we convert and then we look at your 14 cases, inshallah, you understand what the dependent variable and independent variable are better. So, inshallah, we'll come back here by 3:20. I want us to converge. Is that okay with you?
Yes, doctor.
All right. So, inshallah, I'll see you by that time. So, use the remaining time you have now. You have roughly 10 minutes or 12 minutes of this hour, and then the first 20 minutes of the next one to do the discussion among yourselves.
Okay, doctor.
All right. See you by 3:20.
Doctor,
Yes.
the next class through this link or other link?
Through this link, same link.
Okay. Thank you, Doctor.
All right. You're most welcome, sister. Okay. Assalamu alaikum. Hello.
Waalaikumsalam, Doctor.
Okay, so are we back? So it's time, let's start. So let's start with group 1. Group 1, are you here?
Yes, Doctor, I'm here.
Okay. All right, so what are your dependent variables and what are your independent variables?
Our dependent variable is clinical outcome of COVID-19 patient.
Okay, good. Right. How about the independent?
And our independent variable is pharmacology treatment for COVID-19 patient.
Okay, treatment.
Pharmacology treatment.
Okay.
Pharmacology and no pharmacology treatment.
Okay. Write it in full time. Okay, do you have any other variable? Do you have any other variable?
No, Doctor.
All right, thank you very much. Okay, this is actually very correct. All right, group 2, are you here? Group 2 members.
Yes, Doctor.
Okay, what's your dependent variable?
Knowledge towards IIUM tobacco-free campus policy.
Okay, so that's one of your dependent variable. Any other dependent variable again?
Attitude regarding IIUM tobacco-free campus policy.
Okay, attitude. Any other one? Or is that all?
Yes, that's all.
Correct. All right, how about your independent variable?
IIUM staff.
Okay, staff. Okay, good. Which category they belong to? Okay. You mean category. Let me put it as category, right?
Yeah.
Category of respondents. Staff or student. Okay, any other fact, any other thing? Are there things that you think can influence their knowledge and attitude? How about their age? How about their gender, race? Do you think those things can affect their knowledge and attitude?
Yes, Doctor.
Okay, so this is what I want you to figure out, all right? So now you have gotten some of them right. If I tell you some of them, it's easier for you to learn this way, okay?
All right.
That's, you look at other demographic characteristics. Age, gender, race, whether they are smoking status, okay? Yeah, because people who smoke are more likely to be aware of the tobacco-free smoking campus program. That's just my own thought. Okay.
Yeah.
All right. So this is what I think you have also done very well, because at least you are at the early stage of your research. All right, group 3. Thank you, brother.
Welcome, Doctor.
Okay, group 3. Can
Yes,
you make it fast?
yes.
I want to. Okay. What's your dependent variable?
For dependent, SOLQR, and
Okay,
there are a
SOL.
few aspects under it,
Okay.
which are metacognitive skills,
All right.
help seeking, time management,
Okay.
persistence, help seeking,
Yeah, time management.
time management, persistence, and environmental structuring.
Okay. All right.
For independent variables, pharmacy students,
Okay.
And under it, there are few categories, which
Okay.
are year of study,
Good. Year of
gender,
study. Okay, gender.
and
Okay.
experience of online learning.
Experience. How about age?
We decide to compare year of study only.
Okay, I think very good. You also did very well. All right. So at least you have an idea of what it looks, because the definition is actually very correct. Okay. All right, group 4. Thank you, sister.
Yes, Doctor.
Yeah, group 4.
Independent, demographic background, such
Yeah.
as education, age,
You're dependent.
genders.
What's the dependent?
Dependent knowledge or practice or habits of disposal and storage among Malaysian.
Knowledge.
Or practice or habits.
Practice. Attitude, you mean?
Attitude of disposal and storage among Malaysian.
Okay.
For independent.
Storage. Okay, for independent.
Independent. Demographic background such as education level.
Okay.
Age, genders, patient's profile
Good.
background.
Age, gender, educational background. Okay. What again?
Type of medication.
Type of medication. Okay. Any other thing?
That's all for now.
Okay, nice. That's actually very good. I think. So I think I'll put this in the lecture note, in the slide. I will send it to all of you so that you can just look at it and see what we have done, okay? Or should I keep it or remove it out of my slide? I don't know which one you want. Should I put the slides in the lecture notes? Are you with me? Can you hear me?
Yes, Doctor. I'm sorry, my internet connection is slow. Can you repeat again?
Okay. Can you hear me? Yeah, I'm saying that you want me to put the slide for the dependent and independent variables that you have defined for each group in the slide. Do you want me to put it in the slide I will send to you, the lecture materials that I will send to you, or should I remove it?
Maybe you can put.
All right. Okay. Group 5.
Yes, Doctor.
Okay, what's your dependent variable?
For dependent variables, knowledge, attitude, and practice.
Okay. Right. Good. Your independent variable?
For independence, demographic background, such as age, gender,
Okay.
Kuliah,
Okay. Good.
year of study,
Okay.
and last, source of information.
Okay. Okay, very good, brother.
Okay, thank you, Doctor.
All right. You're most welcome. All right, the next group, group 6. Okay,
Yes.
you've changed your topic, right?
Yes, change our topic.
Okay, what's the new title?
A study on knowledge, attitude, and perception on community pharmacy practice or services in Malaysia. Among IIUM Kuantan students.
Okay. Pharmacy student, right?
IUM Kuantan.
Is it pharmacy student or all students?
All IUM Kuantan student.
Okay. Kuantan students. Okay. So what's your dependent variable?
Dependent variable is knowledge, attitude, and perception.
Okay, good. Independent variable?
Based on demographic background, which is the year of study and the gender.
Okay, that's the demographic background, year of study, gender.
That's it for now.
Okay, very good. Oh shit, sorry.
Doctor.
Yes.
Our topic is in Malaysia. Pharmacy
Okay,
services in Malaysia among IUM Kuantan students.
Okay.
Okay, that's all.
Okay. All right. Very good. Okay. Thank you, brother.
Welcome,
Group
doctor.
6. Group 7, brother. Are you here?
Hello, hello.
Yeah, I can hear you, brother. I can hear you.
So for dependent variables,
Yes.
prevalence of self-medication.
Very good. Okay.
Self-medication.
Prevalence of
And last one
self-medication.
is prevalence of self-medication, knowledge on self-medication, and side effects from self-medication.
And satisfaction. Right?
Hello?
Yeah, I can hear you. Do you mean satisfaction from self-medication?
Sorry, I can hear you.
Okay, can you see my screen? I mean, do you mean prevalence of self-medication,
yeah.
knowledge,
Yes.
and satisfaction, right?
Or the last one, side effects.
So, sorry.
Side effects.
All right. What are your independent variables?
Dependent type of medication use.
Is that independent? Okay, yeah, it can be.
Next, frequency self-medication.
Frequency is already prevalence.
Oh, okay.
Frequency is prevalence. What are the things that you think can cause self-medication among elderly people?
Sorry?
What are the things that you think can cause self-medication among elderly people? Do you think family income can cause self-medication?
Yeah.
Okay.
I think so.
So think of those demographic factors that can cause self-medication. How about the type of illnesses? Maybe the patient consider the illness to be mild and they don't need to go to the hospital. Right?
Yeah.
All right. Beside that, is there other thing? Do you think it's more common among male or female? Yeah, source of medication.
Gender.
Very good. I agree. Source of medication.
Source of medication, gender, as you said.
Gender. Okay, good. Okay.
And reason for self-medication.
Reason. If you say reason can fall under dependent and it may be independent sometimes.
Oh.
Depend on the way you want or what you are looking at that particular time. Okay.
Or okay, doctor.
All right. So thank you, brother.
Very much.
Okay, I'm most welcome. Okay, group 8. Are you here?
Doctor?
Yes.
We have changed a little bit for our topic.
Okay.
So for our topic is telepharmacy, knowledge, perspective, and readiness among under undergraduate students, undergraduate pharmacy students, in IIUM.
So what is your dependent variable?
So our dependent variable is the knowledges, perspective,
Okay.
and readiness about the telepharmacy.
Okay, very good. About your independent variable?
For the independent variables, year of study.
Year of study.
Age, gender.
Okay. Gender.
And the exposure to the pharmacy practice subject.
Okay. Particularly if you have been taught hospital pharmacy practice, right? Or advanced pharmacy practice, the innovation in pharmacy practice.
Yes.
Very good, brother. I think I like this. Okay, group 9. Thank you very much, brother.
All right. Welcome again.
Okay, group 9.
Yes, doctor.
Okay, can you make it fast? I want us to take the other lecture.
Okay. For the dependent variables,
Yes.
well-being of pharmacy students.
Well-being
of pharmacy students.
Okay.
Okay, and the next one is academic performance of pharmacy students. Okay, for the independent variables, psychological impact of COVID-19.
Do you think that's a dependent or independent? Yes, okay, I agree. It can be independent and it can also be dependent. Just think of that.
Okay, doctor. And the next one is year of study and gender.
How about age?
Year of study only, and gender.
Do you think age can influence that? Maybe
Yes.
perhaps those who are older may have the mental capacity to withstand stress and other psychological effects more than those people who are younger. Do you think that?
Yes, doctor.
I think you can consider that, okay? All right, okay. Thank you very much, sisters. Group 10.
Hello, Doctor, can you
Yeah,
hear
group,
me?
I can hear you. Yeah, I can hear you, sir.
We also have a new title.
Okay.
So our new title is Assessing Resilience.
Assessing resilience, okay.
Assessing resilience and thriving.
Thriving.
In response to COVID-19 pandemic.
Pandemic, okay.
Among IIUM undergraduate pharmacy students.
Pharmacy student, okay, very good. So what are your dependent variables?
So the dependent variable is resilience and thriving in response to COVID-19 among pharmacy students.
Okay, all right, agreed. What are your independent variables?
The independent variable includes age.
Okay, good.
Gender.
Good.
Year of study.
Okay.
Family background, which can include family income and number of siblings.
Okay.
As well as
Okay.
connectivity issue.
All right, very good, brother. Okay, group 11. Are you here? Group 11. Is the leader of group 11 here? Or is any member of the group here? All right, can we move to group 12?
Yeah. This is
Devon,
my
are you?
group 11.
Group 11.
But our topic is
Yes.
changed now.
Okay. What's the new topic?
Study on depression and anxiety among
Yeah.
pharmacy students during the COVID-19 pandemic using the depression, anxiety, and stress scale. That's 21.
Okay. Using the depression. Right. Okay, I'll correct the title later on. What are your dependent variables?
Oh, my dependent variables are depression and anxiety.
Okay, very good. Okay.
Our group dependent variables are depression and anxiety. Our independent variables are the depression, anxiety, and stress scale. That's 21.
Are you sure about that?
And IUMK pharmacy student.
Okay. IUMK pharmacy students. What are the other independent variables that I want? That's what I want to hear. What are the other independent variables you have? Besides.
We have the gender, year of study.
Okay. The demographic background, you mean, of the student, right?
Yes.
Okay. Very much, brother. Group 12, are you here?
Nice.
Group 12. Group 12 students, are you here? Can you please speak up?
Yes, Doctor. Sorry for the delay.
Okay. All right. What are your independent variables?
Okay. The dependent variable is student perception towards ERTL from academic, emotional, and financial aspect.
Okay, good. What of the independent?
Independent.
Yes, what are the
Independent variable is factors that influence student view on ERTL from academic, emotional, and financial perspective.
No, I mean the independent. What are the things that you think can shape people or student perception?
The one that shape student perception mostly from
what are the things that can affect?
Is
Yes. What are the things that can affect the perception?
Okay, from academic, it will be the cannot focus during class, which means.
Are you sure about that? That's perception already. What are the things, the specific things, the graphic characteristics? Because usually, if you look at it basically, your demographic characteristics are that you can fish out your independent variables from the demographic characteristics. Because most of you are not doing any study involving drugs or any procedure to treat any condition. So from what are the demographic characteristics of the respondents that you think can affect their perception?
Okay, kuliah.
Okay, kuliah. Okay, we're okay. Yeah, all right, accepted.
Family, financial background.
Okay, family income.
The student surrounding. It's about the
surrounding environment, right?
Environment, yes. The study environment.
Okay. Do you think gender can influence that? Maybe male student or female student are more resilient or have better perception? Do you think that could influence?
It might can influence, but we do not come across this gender
Okay.
as
How
a
about
variable.
year of study?
Yes,
Do you
years of
think
study.
maybe
Yes.
final year students can cope more than year 2 and year 1 students?
Yeah, probably because of the experience of using online or maybe adapting to
All right.
the course.
Okay. So thank you very
Okay.
much, sister.
Thank you very much, Doctor, for the guide.
So, okay. Group 13, are you here? Group 13, please be fast. I want to take the last lecture. I have just this 5 or 6 slides for that. What are your dependent variables?
The dependent variable is the effectiveness.
I can't hear you. Can you speak up?
The dependent variable is the effectiveness of medical counseling.
Effectiveness, okay. Medication counseling or medical?
Medical, sorry.
All right. Another one?
The independent variable
Okay.
are
What's the independent variable?
religion,
Okay.
spirituality,
Quality.
type of illness,
Type of illness.
age, and gender.
Age. Gender. How about the type of medication? And maybe your patient has a comorbidity and taking so many medication. Do you think that will affect?
I think yes.
Okay, so I'm just telling you how you can open up your mind and then see other things, okay? And thank God for this, I'm not asking you to give all the variables. I just want to see if you are able to differentiate between them. Because perhaps during your presentation, some people will ask you which of them is your dependent and which one is independent. Okay? Good. Thank you very much, Esther. Okay, I'm most welcome. Group 14. Hello. Group 14 mentioned earlier. Hello.
Yes, Doctor.
Yes, Doctor. 14, are you here with me?
Yes,
Okay.
we are here with you, Doctor. Sorry for the
All right.
delay.
So, no, it's okay. What are your dependent variables?
Okay, so the dependent variable is knowledge, attitude, and perception on medication adherence.
Okay. What are your independent variables?
The independent variable are demographic, like age, the year of study.
Are you sure you're looking at public and patient? What's
No,
year
no.
of study there?
We changed the topic, Doctor. The title.
What's the title now?
Yes.
You
The
said
title is
among pharmacy
knowledge.
student, right?
Yes, among pharmacy student.
Apologies, sorry, I forgot.
It's okay, Doctor.
I think I'm glad that all of you are able to differentiate between dependent and independent variables. Any question regarding this part?
Doctor? Doctor?
Sister? Okay, I
Can
can hear
I
you.
add?
What's the question?
The title among pharmacy student in IIUM.
Okay.
Okay. Okay, thank you, Doctor.
You're most welcome, sister. Okay. So any questions so far for this part? Do you have any question, brothers and sisters?
So far, we don't have.
Okay, so I think let's look at the last part of my lecture, which is measurement of variables. So basically, measurement of variables is looking at how do you measure your variables. Now we have already talked about the variables. What is a variable? A variable is a characteristic that you measure when you do research. And we've classified variables into dependent and independent variables, depending on their characteristics. And we've classified variables into continuous and discrete variables, depending on how they have been measured. So now we're going to look at how do you measure your variables. So the first thing is that measurement usually is defined as the assignment of numbers to an object or an event in a systematic fashion. For example, if you want to measure the weight of a patient or someone, you usually put them on a weight scale, and that weight scale will generate a number which we can use as what the measurement for that patient, the measurement of the weight of that patient. If it is the height, you need to check, and then you take the number as the measurement of the height for that patient. Sometimes if you want to take the yes or no, still eventually you have to assign a number to it. If you say maybe you want to conduct a research among pharmacy students and see the distribution based on their race, at the end of the day you can say, okay, you have 70% Malay students, 10% maybe Chinese, and 5% Indian, and then 5% others. So you still have to assign numbers to this. But in the measurement of variables in research, usually there are 4 different types of measurement scales that are commonly used. So you either use the nominal scale or the ordinal scale. You have the interval scale and the ratio. One thing you need to know is that these 4 different levels of measurements or measurement scales vary in their quality or as well as in the validity of what they measure. The highest level of quality is with the intervals and the ratio compared to the nominal and the ordinal scale. Again, the more powerful the measurement is, the better or the higher the statistical power of the analysis that you're going to conduct, because you will see later on in subsequent lectures that the type of measurement you use will determine the type of statistical analysis that you will conduct. And those statistical analyses that you will discuss later on have different level of powers. Some are more powerful than the others. So if you want to have an analysis with the most powerful statistical tools, then your measurement should look at the use of either interval or ratio. This is not to say that you cannot measure your variables using nominal and ordinal scale. You can also use that and then use the available statistical tests that are available for you to do so. So for, like we described earlier, we can describe nominal scale and ordinal scale can be grouped into what we call the discrete variable earlier, or the categorical variables. This, you divide them into groups. And for the interval and ratio is actually a numerical or continuous variable. You continue from 1, 2, 3, 4, 5, 6 up to infinity. But in nominal and ordinal is actually in groups. Nominal can be yes or no, ordinal can be in hierarchy. Okay, I mentioned this earlier. So let's look at nominal scale. For nominal scale is the simplest level of measurement you can have in any form of research, because it just groups the variable. It does not assign any number to them, and it does not assign any hierarchy to the groups. For example, if you say what is the race of students in the College of Pharmacy, it's going to come out as either Malay, Chinese, Indian, or others, right? So there is no number assigned to Malays, there is no number assigned to Chinese, there is no number assigned to the Indian and others. And statistically, or based on research, there is no hierarchy assigned to Malay, Chinese, Indian, or others. In other aspects or in other contexts, there may be other but in the context of doing research, there is no defined hierarchy attached to this. Okay, so the second form of measurement is what we call the ordinal scale. In the ordinal scale, another example here is you can use also the gender. Gender will group into male, females. Okay, so in other words, for pharmacy student, again, you can have maybe you say year 1, year 2, and year 3 or year 4 student. You have already grouped them into groups. But this is somehow controversial sometimes because someone may argue that year 1, year 2, year 3, year 4 is a hierarchy. But you can also consider this as nominal scale. For ordinal scale, usually what happens here is that it is similar to the nominal scale. The difference is that you assign a hierarchy here, okay? There is actually a difference between the groups. One is considered to be better than the other, and the other is considered to be lesser to the other. For example, now, if I ask you that, what state your level of satisfaction with online classes during this period? And I give you a scale to measure your level of satisfaction using maybe say very dissatisfied, neutral, satisfied, and very satisfied. If you notice, there is a form of hierarchy between very satisfied, very dissatisfied, and dissatisfied. There's a difference between dissatisfied and neutral as well. So there's also a difference between satisfied and very satisfied. But the only challenge is that there is no consistent difference between the gaps between the units. For example, now, if you have, say, maybe the difference between satisfied and very satisfied cannot be quantified. You cannot put it in numbers and say, okay, this is what it means. This is how it means to be expressed. Okay, so this is what differentiates ordinal scale from nominal scale. Nominal scale does group, no number is assigned, and there is no hierarchy assigned at all. But in ordinal scales, they group, but there is hierarchy attached. But the only difference is that the hierarchy, the difference between the hierarchy, the gaps or the units in the hierarchy is not something that you can quantify. Okay. So the third type of measurement is what we call the interval scale. Interval is not categorical. It is numerical or continuous in nature. And here you assign definite numbers to what to the measurement. And the difference between the units, say for example, you have 1, 2, 3, 4, 5, 6, is consistent. The gap between 1 and 2 is 1. Between 2 and 3 is 1. Between 3 and 4 is 1. So there is consistency in it, in the difference between the units. And here, one issue you have to take into cognizance is that there is no defined zero in interval scale. This is what differentiates interval scale from ratio. There is no zero does not indicate the absence of a variable. It means that the variable zero is not defined. All right. Suppose I give you as an example, pharmacy students score on an exam question, and then the score came out to be 0, 1, 2, 3, 4, 5. One thing you have to look at here is that the difference between 0 and 1 is equal to the difference between 1 and 2. And that is also equal to the difference between 2 and 3. So it's consistent and it's continuous in that nature. But the fact that a student has 0 does not mean that the student was absent in the exam. What it means is that it could be that the student was absent, but it could also be that the student was present but scored 0 in the tests or the exam question. Last type of measurement is the ratio. Ratio is numerical, but the difference between the ratio and interval is that there is a meaningful 0 here. 0 here means that there is no characteristic at all at that stage. It's not as the previous case where it's controversial. An example I put here is number of pharmacy students who score grade A minus, or B plus. If you see A plus is 0, it means that what this means is that there is no student that scored A in the exam or in the tests. So that's how, this is what differentiates the ratio scale from the interval scale. Okay, so and I mentioned earlier that the type of scale or the type of measurement you use will determine the type of statistical test that you will use later on. So I think this slide is just like an introduction into what will come later on when you start looking at statistical analysis. So Depending on this scale you use, if you are using nominal, like I said earlier, into groups, there is no number assigned and there is no hierarchy. Ordinal, it's groups, but there is hierarchy. Interval, it's numerical and there is no defined zero, but ratio has a defined zero. So, and by classification, nominal and ordinal are classified as categorical or discrete variable from the previous lecture. I think I have to put the word discrete here to avoid confusion. So, if you are using nominal or ordinal scale for your data collection, usually you are going to use non-parametric data analysis. To know what non-parametric means, I won't bother you with that right now, because I think I just want you to know that, okay, this is what you use. Later on, you can relate. And I think the lecturer that will take you data analysis may explain this as well. Okay, for the numerical or continuous variables, which is interval and ratio, you are going to use parametric analysis. So from what I have said earlier, the slide I've shown earlier, that the level of power of the measurement goes from this direction, from nominal, ordinal, interval to ratio. So using ratio is the most powerful form of measurement. So this tells you that if you are conducting a research that involves the use of parametric analysis is actually more powerful than those that involve the use of non-parametric analysis. But this is not to state that non-parametric analysis is not acceptable. No, it is still acceptable, but in terms of statistical power, in terms of the ability to give a valid conclusion, parametric data analysis are more powerful than non-parametric analysis. I think I won't bother you with this. Parametric, non-parametric, the test in which which is not dependent on the distribution of the data. The distribution of the data that will come under data analysis, I think. And for the parametric, later on, I think Dr. Rahman is going to take you parametric and non-parametric analysis. And when I take the tutorial with you, I will still go over this to see if you are able to just briefly describe for you to be able to differentiate between first the nominal and ordinal scale, as well as the interval and ratio. So before we now go into the types of parametric analysis that we can use for each of these variables based on the number of groups that are involved in the analysis. Okay, I think with this is the end of my lecture for today. Do you have any question? Any question? Or was I just talking to myself? Okay, yes. Yes.
Can you explain again about the ratio skills?
Okay, ratio is what I said in ratio is that ratio is numerical in nature. And it gives hierarchy, and the hierarchy, the difference between the units in the hierarchy is defined. I made mention that we are from 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. The gap between 0 and 1 is the same as the gap between 1 and 2. But the difference between the ratio and interval is that in ratio you have a defined 0. It starts with a 0. 0 means the lack of a characteristic. In interval may not start with a 0, may start from 1, because 0 does not exist. There is no defined 0 in interval. That's what differentiates the interval ratio from the ratio scale. The interval scale from the ratio scale. Both of them are both numerical in nature or continuous in nature. And the gap between the variables is consistent throughout the measurements. Okay, sister, is this clear?
Okay, doctor. Thank you.
Okay, I'm most welcome. Any other question?
Doctor, what
Yes.
if we combine like
parametric, the measurements, different type of measurements, right? You mean?
Yes, different type of measurements in for example in one survey. So does it
exactly. Yeah, it's acceptable. It's a very intelligent question, very good question, sister. In most surveys, you come across this. You have to combine different types of measurements. For example, now you want to measure age, gender, race, and other things. Definitely, this has to be categorical. Or age, you may leave it as continuous so that the respondent will fill in their age and you take the mean or the median later on. But gender is in groups, race is in group, year of study is in group, family income is going to be in group, because if you are collecting data, nobody will want to give you the full details of their family income. It's better you put it in range, say maybe from 1,000 to 2,000, 3,000 to 4,000, 4,000 to 7,000, so that people can easily pick those ranges from one of those ranges, rather than ask them to give it as an open answer. So in most research, you will come across research studies that you can use both interval, nominal, ordinal, or even nominal scales is acceptable. But understanding the difference between these scales is very important, so that if you understand the difference, you will know what statistical tests you will use for the analysis. So this is actually to prepare you for that stage. And alhamdulillah, I'm glad you are able to know the difference between your dependent variables and independent variables. Because later on, if you start the analysis, it's going to be an integration of the knowledge of your dependent variable and the independent variable and the type of measurement you have used to collect your data. If you have used the nominal scale, it will tell you are going to use non-parametric analysis. If you have used the ordinal scale, it's still non-parametric. If you have used the interval, it's parametric. If you have used the ratio for that variable, it's going to be parametric. Okay? So later on, you will come to the stage where you are going to do this. But for now, what I agree with you, sister, you have research projects that we can use, that you can use different type of measurements. So if you have different type of measurement, do not worry about that. You just need to know which one is which and which statistical test you will use for which of the variables that you do later. I hope this answers your question, sister.
Yes, thank you for your very good explanation. Thank you very much, Doctor.
Okay, I'm most welcome, sister. Any other question? You can put your questions in the chat box. For now, I don't worry so much again. Because I used to think your silence means you don't understand. But I've had 2 class activities with you and the response has been very excellent. So now if you keep quiet, I assume you just understand and you don't want to talk. But if you have anything to say, please just talk. For me, I don't have any issues. I can re-explain, then try to put it in a way that you understand to the best of my abilities. Any question? Any question, dear students?
I think so far no, Doctor.
Okay, because I've finished my lectures already. I've finished presenting my slides. So I'm just waiting if there's any question. If there is none, then I just call it a day. All right. So inshallah, I will upload the lecture materials on iTalim as well as in Google Team soon. I think I'll do that before I leave the office today. So unfortunately, you will get it today, and then so that you can start your preparation for the quiz next week. As for those people that missed the lectures on the first day, I think I'll still post this message in the group. Thursday, perhaps in the morning or in the afternoon, so that I just maybe use 1 hour or 45 minutes to discuss what I discussed with those people who attended the lectures on the first day. And if any of you is interested in joining, and then I will gladly welcome you to the session to explain what I discussed with you in the first day. So I think with this, I will say Assalamu alaikum to all of you, and I wish you a very good evening.
Waalaikumsalam, Doctor. Thank you very much.
Okay, I'm most welcome.
Thank you very much, Doctor.
You're most welcome. Have a good evening.